And our next speaker is Dr. Gregory Mercier. He is the head of data science unit and specializes in health economic analysis, particularly in innovations. His work focuses on healthcare utilization, patient preferences, and out-of-pocket expenses. So policy side also is touching base. Dr. Mercier, please go ahead and take over, sir.
Yes. So, hello everybody. Hello, Shashi. Thank you for the invitation. It's a great pleasure and an honor to be here. Let me share my presentation. Okay, can you see my slides?
Yes, we can. Yes.
Okay. Is it full screen?
No, it is not full screen.
Is it better like this?
It's better, but go ahead and give a shot with full screen. If it works full screen, that's even better.
Is it better now?
Yeah, yeah. I think it's still the same, but that's okay. That's okay.
Okay. Sorry. Okay, so thank you very much again for the invitation, and let's move from the skin with this very interesting presentation just before me to the environment. So let's change scale in a way. My focus today is about what we know of the environmental risks about longevity, and what can be done at various levels to address these risks. I'm working at Montpellier University Hospital in the public health department, and I'm also head of a startup company which name is Canopy Med, working in the digital health area, to put it simply. So the first question we want to look at is actually why. It's a very simple, very basic question. Why is it so important to look at the environment, generally speaking, when we consider longevity? So if we look at this figure, which has circulated a lot, which has been sometimes criticized, and I'm aware of that. But what this very simple figure says is that if you want to improve your health, you have to be aware of the determinants of health, and specifically four groups, four areas of determinants. The first one at the bottom is healthcare, of course, access to healthcare, and the performance of the care that you receive will have an impact on your health. Second one is health behaviors, and I'm going to say a few words about it later. And then, of course, we have the physical environment with a very broad definition, including housing, which is usually thought to account for about 10% of our, let's say, general health state. And then the rest is pertaining to socioeconomic factors. And I'm not going to mention and to explore those factors further today, because it's obviously depending on usually on policies at the national and sometimes at the international level. So if we start with health behaviors, and that's just a very quick reminder that there is a growing body of evidence of successful and sometimes very powerful interventions that have been proven to improve your longevity at the individual level. And again, that's just a background information for us today. So it's about diet, it's about exercising, non-smoking, not drinking alcohol, managing stress as far as possible, having fruitful social connections, and having a high quality and high quantity sleep. So that was just to remind you that we already know that we already know in terms of individual people's health behaviors, how to improve longevity. Then, yes, so I was saying that level 1 was simply health behavior, then level 2 is healthcare. So we know that healthcare accounts for 20 to 25% of health and longevity. So again, that's just a quick reminder for you, background information that we already know a lot about effective, successful interventions, which are evidence-based and recommended depending on your gender, age, and so on. And so that was just to give you a very short example of what a 45-year-old man similar to me should do in terms of preventive healthcare in order to improve one's longevity. But again, that was just background intervention. And then there is also the biomarkers of aging area, which is growing. And again, but that's not the main topic of my presentation. And you probably know better than me that there is a growing number of biomarkers which have been validated, and for few of them regulatory approved as biomarkers of aging. And so let's now move to the core of my presentation, which is going to be about the effect of physical environment on longevity, and to what extent we can implement specific actions and specific interventions to improve that physical environment and to alleviate its burden on health. So the environment is usually considered as being level 3 in terms of longevity factors. It's more or less 10%. And the first key message is that environment usually refers to a very broad array of external factors. And this is the way the World Health Organization, the WHO, usually describes those factors. And so, of course, air pollution, but also water, chemicals, radiation, noise, occupational and agricultural practices, built environment, including housing, and also climate change. And so I'm not going to cover all of them. I have selected 3 specific examples of environmental risks on purpose. And let's now dig deeper into the first one, which is climate change. So as you know, one of the consequences of climate change is an increased prevalence and also an increased duration of heat waves. So that's the topic of extreme heat. And so there is now a scientific consensus about the effects of heat waves on health. And the key message here is that those effects are really major in terms of physical health, and what might come to your mind is dehydration and hypothermia, but you have to know that extreme heat and heat waves are major killers of patients with chronic diseases. So typically, if you are a patient with diabetes or chronic heart failure or COPD, so that's chronic respiratory failure, you are at high risk of acutization, hospital admission, and even death during a heat wave, and also during the days following a heat wave. There is also a growing body of evidence about the effect of extreme heat on mental health, and that's concerning because you know that in some countries, mental health has a growing contribution in terms of mortality too. And there is also an emerging body of evidence about the effect of extreme heat on maternal and neonatal health. So first, there is no debate that heat waves have a very major effect on longevity. including in terms of mortality. And just to give you a very specific example, so that's daily mortality figures for France. Each line is for a different year in the past. And you can see two pikes here. The first one on the left is the increase in mortality due to COVID-19 back in 2020. But very interestingly, you can see on the right a different pike, which is actually higher. And so that's the increase in mortality due to a major heat wave in France more than 20 years ago. That was 2003. And so the message here is that in terms of the intensity of mortality increase, you can see that a heat wave, a major heat wave, is actually very close to what the country went through during the first COVID-19 wave. Okay, so really a huge effect in terms of mortality across the population. Let's now consider a second environmental determinant of health, which is air pollution. I'm not going to go into more details about the various pollutants that are known to have an effect on health, but my focus here is that when you think about the health effect of air pollution, you have to think about short-term effects, and that's the left part of my slide, and you also have to think about long-term effects. And to put it simple, if you combine these short and long-term effects on the population, you come up with a reduced life expectancy, and that's the bottom line of this slide. So air pollution is associated, and there is now also a clear scientific consensus on the fact that there is a negative effect of air pollution on longevity and life expectancy. All right. So one question that one might ask is, what can we do about air pollution? Where do we stand at the global level? And is there a way to improve air pollution? And so that's a first, let's say, optimistic or positive take-home message from my presentation today is that if you consider this specific environmental risk, we collectively, we know how to be successful. So these four charts show over a very long period of time, so from the end of the 19th century to now, actually, 2020, and in four different cities across the globe. So you have London, UK, you have Beijing in China, top right, then bottom left, you have Islamabad in Pakistan, and bottom right, you have Jakarta in Indonesia. And very interestingly, the researchers used, of course, the same colors and the same scale to show the average exposure to air pollution of this population on a yearly basis. And so if you look at the London situation, which is very interesting, you can see that the worst time period in terms of air pollution in London was somewhere between the beginning of the 20th century to the end of the 60s, of the 1960s, okay? And so since then, we see a constant and actually dramatic improvement in terms of exposure to air pollution. And with very few exceptions, you can see that for at least 20 to 25 years now, air quality is not very good, obviously, but it's, let's say, fair, according to the study. Then if you look at Beijing, and sorry, that's the consequence of various regulations, local, regional, and national level, and sometimes European level regulations and laws aimed at reducing emissions. And that was mainly in the industrial sector and also in the car industry sector that the regulations were the most successful. Then if you consider Beijing, the picture is very different because the increase in air pollution started much later in time. It actually started in the 50s, in the 1950s. And then they reached the peak very recently, like 5 to 10 years ago, a very high peak, higher than in London. But then again, successful policies are currently being implemented, and they are associated with, you can see a dramatic reduction, at least in the concentration of particulate matter. So again, different country, different place, different general, let's say, environment, but still there is an array of useful policies that can be implemented. And then, of course, some areas in the globe are more concerning if you consider the situation of Islamabad, bottom left. So we are still in this increase trend, which means that the population in Pakistan is currently exposed to a very high level of air pollution. Okay, so again, the bottom line here is that each country and even each city within a country has a different situation, but there are now lots of actionable and very useful and powerful interventions and action that can be taken, usually at the national level, to fight against air pollution. All right. And typically, if you're interested and you want to go deeper into the policies that are effective in terms of air pollution reduction, my recommendation is to go through the documents of the World Health Organization, and it's very clear actually. And again, there is a very broad evidence-based consensus on the matter. Let's move now to the third environmental factor that I tried to focus on. It's microplastics. So I actually decided to focus on microplastics because yesterday morning, a very interesting paper was released in Science, so in the Science journal, one of the best peer-reviewed journals, trying to review all the available evidence on microplastics and their impact on health, and also how we can reduce the exposure to microplastics. And so the first very interesting fact is that on average, I and you are ingesting each year more or less a plate full of microplastics. That's around 250 grams on average every year that we are ingesting. Okay, what are the sources? And so that's why they are usually considered totally unavoidable, impossible to avoid, because they are found everywhere, and of course they are very small, and you can not even notice that you are ingesting those microplastics. Where do they come from? You can see on the left, they mostly come from macroplastics. That's actually litter that is very slowly degrading from micro to micro size. And so that's by far the first source of microplastics. But then we also see that paints, for instance, and also tires are very important sources of microplastics. Just to say that they tend to come from a various number of sources, and they tend to be disseminated across the environment. What do we know about their effects on health? Again, I would say that the evidence is slowly growing. We don't have the same level of evidence as we have for heat waves, for instance, or air pollution. But what we know for sure is that they have been found at various concentrations in, I mean, virtually any part of the human body. You can see the red lines are for anywhere in the body where microplastics have been found in significant concentrations. So from blood to hair, liver, kidney, etc., etc. And also there is an interesting description of the sources of microplastic. Of course, dietary intake is probably the most important one, but we also have to mention inhalation, and that's, for instance, the case of microplastics that are from cloth, from synthetic cloth, and also from tires that are, let's say, disseminated across the air, and so inhaled. And also there is a third, let's say, way, which is dermal absorption, because lots of microplastics are in various consumer products, such as cosmetics, etc. And so that's actually very interesting to also have in mind that it's not only about dietary intake, and there are actually several ways to improve this. The most important part of this science review, which was released again yesterday, so I was very lucky to have it, is that they also review the potential interventions to reduce the amount of microplastic in our environment, because if you put it simple, they are everywhere, so and they are almost impossible to avoid. So the best way, and probably the only way, to reduce their impact is just to reduce the volume of microplastic, which is just generated by the human activity. And so I'm not going to describe all of those potential interventions, but what I want to highlight is that all those interventions are regulations or policies, and sometimes also monitoring activities, etc. And so, to put it simple, all of those interventions are linked to decisions made at the national level and sometimes even at the international level. There is a good example of regulation in Europe, which is the REACH regulation, which has banned a large number of goods and of products because they were important sources of microplastics. And so that's just an example. And so again, if you come back to the fact that they have huge effect on health, and if you consider that the only way to avoid them is through national or international regulations, that gives you an idea really of how it is, how difficult it is to tackle this issue of microplastic. And again, if we want to be more specific, there is now a growing body of evidence about the effect of environmental pollution, but also specifically on microplastics on health. And I went through this very interesting paper, which is trying to explain why we see in lots of developed countries an increased prevalence in terms of early onset cancers. So that's cancer diagnosed at an early age. And so you can see very alarming, very dramatic increases. That's American figures. For instance, biliary tract cancers, they increase by almost 8% at an annual percentage change rate. So that's really huge. And one of the causes, of those early onset cancers are, you can see, microplastics. So there is now a really hard consensus on that, but also environmental pollution, and also, of course, other more, let's say, standard factors. So just to say that even if you focus on a specific epidemiological trend that we can see now in the US and to a lesser extent in Europe, it's probably at least partly explained by the increase in terms of our exposure to microplastics. Some take-home messages, and that's going to be my last slide, to state actually very, very simple and very basic facts, but I think you have to keep them in mind if you're in the longevity area. First, you have to keep in mind that, let's say, around 10% of health and mortality are explained by environmental factors. Number two, The problem is that if you want to tackle those environmental risks, you have to take usually complex, coordinated, and sometimes even international level actions and interventions. But, and that's a positive aspect, there are examples of successful policies. And typically, if you consider the air pollution situation, specifically in Europe, and to a lesser extent in China now, there is obviously, there has been dramatic progress made over time. And then, of course, if you consider heat waves and so climate change and also microplastics, it's obviously even more challenging because you have to think of innovative regulations and also coordinations action at the global level. All right. So that was it. Thank you very much again. And let me know if you have any questions. I will be happy to answer. Thank you very much.
Thank you, Dr. Gregory Mercier. It was very, very interesting presentation, especially on the microplastics and the nanoplastics. Thank you so much for your insight.